And of course, he lost his battle to colon cancer, which brings us to the fact that it is the third most common cancer in the U.S. and second most common cause of cancer death in men and women combined. Joining us now is Dr. Ronald Tang. He's an oncologist with Dignity Health, the Dorothy Levy Cancer Center in Northridge. Dr. Tang, thank you for your expertise. It's of the utmost importance right now, given the loss of Chadwick Boseman. Such a surprise, such a loss.
Very shocked.
The thing here, though, is colon cancer is highly curable, over 80% if detected early in stage 1 and stage 2 cases. So why are we seeing an increase of younger people with it and minorities in particular being impacted?
Yeah, that's a great question. I think a couple of things. I mean, in terms of the younger patients, this has been increasing since 2008. 1% per every year for patients that are younger than 50. We think it's maybe due to the environmental, but it's hard to tell. In terms of racial disparities, African Americans definitely do worse stage by stage than their Caucasian counterparts due to a couple of things. I think it's access to care, as well as their diet, and that leads to access to care too. Increase in obesity, diabetes, high blood pressure. Those are all risk factors for colon cancer. Also, a diet in low fiber and high red meat can also cause these things to occur. So I think diet and obesity and lifestyle has been a main driver, I would say.
Okay. Well, with that said, I mean, given the fact that Chadwick Boseman, he was diagnosed when he was, if you do the math, 39, so in his 30s, yet when it comes to how young you should be when you get tested, the CDC updated the guidelines. So talk more about that.
Yeah, so this year they updated the guidelines from 50 down to 45 just because of the statistics that people that are under 50 have a higher incidence of colon cancer. So, I don't know in terms of Chadwick's case, but patients who also have a family history, which means a first-degree relative with colon cancer diagnosed under the age of 50, should get screened sooner than those guidelines.
Okay, so for both men and women, 45. If you're 45, you should get your colonoscopy now.
Absolutely.
Okay, and then let's talk about the warning signs. What do we need to be aware of?
Yeah, the key red flag symptoms are abdominal pain that does not go away within 1 to 2 weeks. Second is the most common and kind of red flag symptom is when bright red blood in your stool or black tarry stools, also known as melena, and as well as unintentional weight loss. And some other common symptoms are nausea, vomiting, fevers, chills, and night sweats. All these, if they are consistent, you should see your primary care doctor immediately.
Okay, and an alarming statistic that you shared with us is that screenings are down 90% year over year because of COVID. But so you shouldn't be afraid to go see your doctor and get this done.
No, you should not, especially if you have these symptoms or if you're due to be screened. I mean, now at this point in time, the hospital and the doctor's office is very safe. And furthermore, we have most physicians and hospitals are following CDC guidelines. So screening should be a priority for you. Absolutely. You should not push screenings down just due to the COVID pandemic at this point in time.
All right. Dr. Ronald Tang with Dignity Health, Dorothy Levy Cancer Center, Northridge, thank you so much for your time.
Nice talking to you. Take care.
Okay, you too.